Very welcome to this webinar on RevMan, an online tool for how to make meta-analysis easier. And this is a joint webinar delivered by Cochrane RevMan, Cochrane Sweden, and Lund University, the Faculty of Medicine Library. My name is Maria Björklund, and I will both speak here today, but mostly I'm facilitating the webinar, and I'm coordinating the library support to literature reviews. Our speakers will introduce themselves as we go along. And today you will be guided through RevMan, and we will talk about why meta-analyses are important. Of course, you will see a demonstration on how to do meta-analysis using RevMan and see the easy features there. We will talk about how to get access to RevMan, how to sign up, and what available support and courses there are for you. And of course, at the end of the webinar, there's plenty of room for your questions on meta-analysis or on RevMan. So with that said, let's get started. And I will hand over to Matteo, who will walk us through why meta-analyses are important.
Thank you very much, Maria. And thank you very much, Maria, for all the great work you've done for many years for Cochrane and Cochrane Sweden, and sharing energy, enthusiasm, resources, everything. We feel very privileged to be based here at Lund University, and also to the Lund University Library, of course. So today I have just, I think, 5 slides. It's very informal, and questions, comments are very welcome anytime from the participants. And my task for these few minutes is to mainly sharing my experience, why I think that systematic reviews and meta-analysis are so important when they are well conducted, because this is rarely the case. Many systematic reviews have poor quality. Could you please go to next slide, Maria? Thank you. And I'd like to share this true and recent story. For a few years, we've been working here at Cochrane Sweden on caffeine in preterm infants born too soon. And so we produced a few Cochrane reviews about this topic. And then the World Health Organization, WHO, asked us to produce additional reviews for the production of international guidelines, which was done. And following this, we got a grant here in Sweden to prepare Swedish national guidelines on the same topic. So we developed a new series of reviews to cover additional questions within the same topic. So this is just an example why systematic reviews, in this case within Cochrane, can be useful, because they aim to guide clinical practice worldwide. And in our case, with the national guidelines, specifically here in Sweden. So guidelines are reliable, are useful, only if are based on well-conducted systematic reviews. And so this is an example, guidelines. And then, of course, can be the clinical practice for nurses, physiotherapists, medical doctors, but also for patients to know what is the best evidence available. So in the next slide, there is one simple plot. It's called forest plot. This is generated in very quickly and easily with RevMan. We're not here today to sell anything, because thanks to the university, we have all these tools in place. No one has to pay to the university for this tool. But when we do systematic reviews, of course, we need to have a meaningful and relevant clinical question, like in this case, to save lives of preterm babies by the correct use of this drug, caffeine. And so we have this project. First, we publish the protocol, then we screen thousands of studies for inclusion and exclusion. And then, like in this case, for this specific outcome, it's in the red box, chronic lung disease, we ended up with 5 studies reporting this outcome and comparing high versus standard dose. So why RevMan is good? Because by simply putting these 4 numbers for each study, we can get the meta-analysis. So the black diamond in this, this forest plot. So this is 0.75. It's the effect. This is the risk ratio by combining these 5 studies. When you do narrative reviews, if you do other type of evidence synthesis, normally you don't produce this meta-analysis. But with the RevMan, you simply put this number. If you look at the first row in this forest plot, mod 2021, there are 10 events, so 10 infants with this outcome or disease, out of 40 randomized infants. And then in the other group, in the control group, 14 out of 38. So this is the only thing we have to put in RevMan. And RevMan is doing the rest. So all the calculations for each study and then the black diamond. In this case, we have a risk ratio. So this means, I hope not to be boring, but 0.75 means that it is a 25% reduction in relative numbers for this outcome. So the incidence of disease relatively 25% lower because it's 1 minus 0.75. In this case, we have the risk ratio, but it's possible in RevMan by clicking one button to change to risk difference. So in this case, we have the absolute values, so this number 0.75 will be very different, like perhaps 5 or 8% lower compared to two groups. So there are many functions in RevMan that very easily allow us to explore different things, statistical aspects, but also if you look at the right side of the forest plot where these colors we represent the risk of bias. So for each outcome, for each study, we can, again, by clicking one button, show or hide the risk of bias. So how these studies were planned, conducted, and reported. Thank you, Maria. If we could move to the next slide again. Yes, this is a result from another review, which also has been citing different international guidelines. And it's about sustained inflation. Anyway, it's a type of how to resuscitate babies in the delivery room. And we published this review, you can see in the red square on the left, 10 years ago, the first time, 2015. This was a hot topic a decade ago, so we were aware that there were more and more studies. So we have updated the Cochrane review already 3-4 times in the last years. And last time was 2025. So in 2015, we have only these 2 studies, and which is a bit worrisome if you look at these numbers, because it seems that the intervention, instead of saving babies, is wow, this price is increasing because there are more cases of death, 20 in total, compared to 12 in the control group. But of course, you can see easily that there are only 2 studies, small studies, a lot of variations, very imprecise. So Maria, if you click again, please. Thank you. So this is the very last update, so published in summer 25. And you can find that the 2 studies before, List and Lindner, are at the very bottom of this forest plot. And now we have many more studies published after 2015, when the first Cochrane was published. And you can see how the numbers have changed. So now we have that the risk ratio, instead of being 1.55 like 10 years ago, now it's 0.99. So there is no effect, no benefit, no harms about this intervention compared to control for this outcome. So again, with RevMan, when we periodically update the reviews, we can just add the new evidence. And you can, I will make one more example, same on the same slide here. You can see that we decide in this forest plot to order the study in a specific way. So RevMan allows you to choose alphabetical order, chronological order publication. But in this case, we choose actually by effect size. So you can see that first 3 studies, no events, there is nothing. And then we have the Abd, El Chimi, Abuel, they're on the left side. And then gradually they come to the right. But altogether, the meta-analysis is 0.9, so it's on the vertical and horizontal difference. I have one more slide with the forest plot. If you can move, thank you. This is a review not on my group, it's done by others, but this is also, I think, it's a beautiful example. You can see that there is this study, the fourth, the one in the red square, that is telling different story. All the other studies are nicely overlapping, whereas this study, Ginsberg 2012A, has different numbers, so a significant reduction in this outcome. If you look also at the right side, you see that the same study in the risk of bias assessment is the study with a lot of red color, so high risk of bias. So it's very likely that the different findings of this very study, number 4, is probably due to this risk of bias. Again, with RevMan, you can deal with this, like this case, simply visualizing, or you can do, for example, sensitivity analysis. You just click one button in RevMan, you can exclude the study and to focus on the others, or to organize the study into groups with high risk of bias versus low risk of bias. All of these are options that are easily done in RevMan. I think I won my last slide, Maria. Yes, we know that there are hundreds, maybe thousand people at university using Confidence, which is a tool for easily screening study for input exclusion. If you are doing systematic review, especially with meta-analysis, we really recommend to use RevMan because we have everything here. We have beautiful people like Maria and colleagues who have all the online tools, and RevMan is a perfect match with the Confidence, and they're built to work nicely together. For example, you do the work in Confidence, you export, you import in RevMan. This was my last slide, and I'm happy to take any questions later on. Back to you, Maria.
Thank you, Matteo. And you're quite right here. It's very nice that the tools we have in our review toolbox, they work very nicely together. I think you are now very curious to know more about how RevMan works. So we will hand over to Rebecca to show us how to do the cooking. So Rebecca, the floor is yours.
Oh, I wasn't aware this was a cooking course. What have I signed up for? Thank you so much for having me. I'm Rebecca Hall and I'm product owner of RevMan. So I work with the team that works in the central executive team of Cochrane to improve RevMan all the time. So we have releases every 2 weeks to improve RevMan with new features. So that might be useful to know. That if there's something you think is missing, you can always send in a suggestion and we might address it. But today we will just look at the basics. So we're going to generate one meta-analysis for a dichotomous outcome and one meta-analysis for a continuous outcome. And then I'll show you the sensitivity analysis feature that Matteo has already talked about, as well as how RevMan can help you report your results if you choose to also write your article in RevMan. So that's the plan for the demo. So if you go to revman.cochrane.org and log in with your Cochrane account, you will be able to see the reviews that you've been given an author role on. With an institutional subscription, you'll be able to create your own reviews. But I will start from a point where there's already a review. So I'm going to use this review, which is talking about immediate or early skin-to-skin contact for mothers and their healthy newborn infants. And so actually I had some slides, but I will show you the analysis here instead, since we're already here. So this review is looking at whether early skin-to-skin contact has positive impact on different outcomes for mothers and newborn infants. And the two outcomes that we'll be trying to replicate basically is exclusive breastfeeding 6 weeks to 6 months post-birth. So you could see that I'm now in RevMan looking at the analysis for this review. It's a published Cochrane review. And so here you can see the forest plot with the different results. And so exclusive breastfeeding is a dichotomous outcome, which means that it's either true or not. So we can see the events and totals here. And we're going to try to recreate this analysis. And the first step is actually not to add the analysis, but you need to make sure that there are studies in RevMan that you can include results for. So for that, we go under data to studies. And of course, this review already has some studies. If you want to cite the studies and write the article, you can import references in bulk using our import feature. But otherwise, you can just add studies that have like the study name so that you know what they refer to in the analysis. And then the next step is just to add your analysis in an analysis group. So In the left-hand navigation, I'm going to Analysis. I'm clicking Add Analysis Group. And you can give this analysis group a name. Normally this is a comparison, and that's what I'm going to use here. So the intervention is early skin to skin contact versus standard care. And then you can go ahead and add your analysis that is included in this analysis group. In today's demo, we're going to look at manual analysis, but there is also an automatic workflow where you sort of describe your interventions and outcomes separately, and then RevMan pulls in data automatically. The manual analysis is often used for smaller meta-analysis that are more straightforward, or if you already have the data in this format. If you want to use the confidence import, you should use the automatic option. But I'm going to go ahead and add this manual option, and we will give this analysis a name. Maybe we should, I'll just base it on the name on the outcome that we're interested in. So that was exclusive breastfeeding at 6 to 6 weeks to 6 months. And then what you need to do is you need to select some options for your analysis. And so for this outcome, the data is dichotomous. So the data type will be dichotomous. We will look at another example for continuous as well. But as you can see, there are some more options because RevMan is really flexible in what it supports. You will then select some statistical settings. I think this analysis was using a risk ratio. So that's what I'm going to choose as an effect measure as a starting point. And I also think that it was using random effects. And since we're here displaying the random effects, I'm going to also show the new features that's been introduced, I think, after this review was published. So if you're using random effects, you can select some different methods, and you can also decide to show a prediction interval, which can basically help you interpret your results and the heterogeneity. So the next step will be to add the data. And at this point, I think I will open Excel because I have the data. So this would assume that you had extracted your data and in this format of the manual analysis. Let's see if I can remove you. There we go. And I just add data rows for each of the relevant studies. So we have Anderson, we have Carfoot, we have Gauchon, Lau. And of course, if you are just generating one forest plot, it will be easy. You can just select them all. And the last one here. And when I click Add, you can see that the table for the meta-analysis is built. And now what you can do is really simple. You just copy the data, you paste it into RevMan, and boom, now you actually have your meta-analysis ready. To see your forest plot, you just go to the graph section. I'll move back to only looking at RevMan now. And so here you can see the meta-analysis has been generated. You can see the forest plot and the pooled estimate of 1.33. Matteo was talking about the sort option. So you can see here, this is where you would sort. If you want to sort by weight, you can do that. Or you can sort based on the effect size as Matteo did in his review. So now that I've only pasted these results, there's no risk of bias data. But if we go back to the analysis that the review authors generated, there will be some data for risk of bias. And you can see that there's actually one study here that has higher risk of bias than the others. And so it might be interesting to look at how the results would be if that's not included. And then you would click at this investigate sensitivity, and that would allow you to, for each of these studies, you can exclude that row, and then the results will update. So you could see it went up to 137. You could instead, you can go back and include, and you can also easily change which effect measure if you're just interested in seeing which effect measure might be most useful. Of course, you shouldn't. You should have thought earlier about which effect measure is most useful. But in terms of understanding a result, the risk difference can be easier to interpret as a starting point. Okay, so that was the dichotomous analysis. Let's have a look at the continuous one. So there is one example in this review where we look at the duration of breastfeeding in days. That's a continuous outcome. So let's try to recreate that instead. And let's use the analysis group we created before. I will add a new analysis. Again, I'll use the manual analysis. I'll give it the name duration of breastfeeding, and then that's a continuous outcome. You may, if you want to, change the group names. So we could say here, and in the other one, we could either say control or we could say standard care. And so for the continuous outcomes, you'll get the choices of mean difference and standardized mean difference as effect measures. That's what RevMan supports. And for this review, we're looking at mean difference. Again, we're going to choose the random effects. And then we can just add the data. So I'll show again. So I have a second sheet for continuous data, which of course is a bit different. So for each study, you will now need to have a mean, a standard deviation, and a total for each group. And you can then add the studies. There we go. That was 7 studies, and you can just copy the data over. and we will have our meta-analysis. Actually, we may, of course, want the totals as well. So you could just copy that like that. And if we go to the graphs, you'll see now that the meta-analysis is here. Again, we see that there's one result here that's quite different. So we could go back to the analysis and investigate sensitivity analysis and see what happens if we exclude that. So that's like a basic demo of setting up a manual analysis for dichotomous and a continuous outcome. I'll just show you briefly how you can easily report these results and ensure that the data is actually kept up to date in the text. So you can see in the left-hand navigation, the contents here is really allows you to write the whole review. It has standard Cochrane headings, but there are also flexible review types which you can use if you don't want so specific sections to the Cochrane methodology. For now, I will go to the results section and the synthesis of results, where you can see that the authors have described the different analysis results. And so you can see here that there's a result reported for exclusive breastfeeding. And you can see that it's a link. And what that means is that if you include any new studies or change settings that will change this result, you'll actually be notified and it will be updated. And I'll show you how that looks like, because if you edit this, you can actually change. So in this case, I would also like to include the participants. And if you update that, you'll see that there's this small warning here, and that indicates that this result has been updated. So if you, for example, come back to update your evidence, include new studies, then the reporting would automatically update. And the reason we have the warning is because, of course, you need to think about the sentence that it's been described in and ensure that that sort of still relates correctly to the actual result. So that was a quick summary of the core features of RevMan. I'm really happy to take your questions when we get to that point, but now happy to hand over to you, Maria.
Okay, thank you so much, Rebecca. That was really nice to see the features, and it looks really easy when you show it. So I hope the rest of you also perceive that it's easy to get started. Thank you. If you do not have signed up yet for RevMan, it is available for anyone affiliated to Lund University, staff and students. And you can find it via the portal for digital resources. We have put it in the database list. That is the easiest way for us to distribute access to tools. So if you go in there, you can find RevMan. We will also send out the slides here for those of you who are here today, and then we'll have all the links to the tools. So if you then go onto the RevMan website, if you click on the pricing and subscription, you will be recognized as a user at Lund University. So do check that the institution is Lund University when you log in or create an account. If you already have a Cochrane account, you can use that and get access. Otherwise, you create an account and can start use RevMan. You will receive an email confirmation of your registration, and you will also receive a link to RevMan in another email. And do not get alarmed if you also get an email that looks like an invoice. It is not an invoice. You will not be charged for this, as we have a subscription for the whole university for this. If you sign up now, you might also get notified that your license will be valid through January 2026. We are renewing our subscription annually, and we will do so also for next year, so you will have continued access to RevMan. So these are some tips on how to get started and how to register for RevMan. We have already talked a bit about additional tools for review management that are also available for anyone affiliated to Lund University. We talked about Confidence before, perhaps you're familiar with that. We also have access to Cochrane Interactive Learning. Confidence is a tool for literature reviews that supports the selection, documentation, collaboration, and you can also do a risk of bias and data extraction. And once you have finished, you can of course then export the results to RevMan. If you want to learn more about the process of conducting a systematic review, then I can highly recommend Cochrane Interactive Learning. It's a set of interactive modules that walk you through how to do this, meta-analysis included, and all the considerations you may have to do before you get started. So that's really a gold mine to get started with. Now I see there is something here in the chat. Yes, thank you, Mattia. You shared the link there. Thanks. And these tools are also available through the database list in Finn, the portal for digital resources. And you sign up with your Lund University email account, your @med.LUSU account. For those of you who wish to collaborate in Confidence or RevMan, it's really nice that these tools are open for collaboration. So as long as one team member is affiliated to Lund University, then you can invite others to collaborate in the same review project. So that's really nice, I think. So feel free to explore these tools too. Now I will hand over to Martin, who will talk a bit about courses and support.
Yes, hi everyone. So I also work at Cochrane Sweden, but more in the line of helping out with training and coordinating courses and also delivering courses. So if you want to know more, not just about meta-analysis, but also for the whole review part, from a systematic review or a scoping review, we have our 1 week course here at Lund University. So it's open for everyone to apply to, but PhD students have the first pick, but usually everyone from Lund University gets a place. But over 1 week, we go through the full process of creating a systematic review according to the best Cochrane methodology. So from searching, meta-analysis, risk of bias, and all the way to reporting and using reviews in decision making. So that's something I can recommend. And you can reach that from our website through these links. And if you only want to focus in on meta-analysis, we have recurring workshops, for example, about meta-analysis. So once every year or second year, we usually have a 2-day workshop only about meta-analysis, where we bring in the experts from Cochrane, and also Rebecca was part of our last course, going more into like the depth features and really understand what is a random effects model, what is a fixed effect model, and when to use them and when not to use them, for example. And finally, if you need some sort of smaller support to set this up and start using RevMan, you can contact us through this link as sort of a method support. So we will help you for free for small things. But if you need like full-on support for a full review, for example, we're also available for to take in as consultants for those systematic reviews or those meta-analysis projects that go beyond just setting things up and understanding the basics of it.
Okay, thank you, Martin. I think we will leave the floor now for questions. So feel free, anyone, if you have any thoughts, questions, comments on either meta-analysis or RevMan or something related to that. It is also fine to post questions in the chat if you are not comfortable about saying them out loud. I think Sonia has a question. Please go ahead.
Yes, it's a smallish question about the RevMan. I saw that there was a graph about risk of bias, and I didn't quite get, was that a separate analysis that you as an author had did, or did RevMan import the original article's risk of bias analysis?
Yeah, so I was showing you a copy of a real review, of a Cochrane review. The risk of bias assessment is like a process that you can go through, and then you can either import the data into RevMan or enter it manually. Matteo?
Yes, so there is no something like AI in RevMan that is doing a risk of bias for you. So it's the authors of the review that they're to think, discuss, two people independently, and then the consensus, and then you will import it to RevMan. There are then different options. If you do, for example, with the template by confidence, then yes, so you can to do the work by thinking, discussing, disagreeing with the others in confidence, then you export to RevMan. Or you can do, for example, if you use risk of bias 2 for trials, you do in an Excel file, do the consensus, and then you can copy paste from the Excel file to RevMan. But yeah, so risk of bias 2, the assessment is outcome by outcome. With the old risk of bias, is study by study. Yeah, there are differences also depending on the type of review. And what I was trying to say before, perhaps I was a bit unclear, that I should have said once you have done the risk of bias, the consensus, then you can report it in RevMan. Then when this is done, you can show it, hide it, do sensitivity, also group analysis based on different things, include the risk of bias. Thank you, Sonia.
Thank you.
Okay, any other questions or thoughts?
And Rebecca and her team are very active. So every couple of weeks there are news about RevMan. So there was a summary, also the guidance and so on. And especially in the last years, there's more and more progress, I would say. And a new function that allow to save time, like to import references just with the DOI or how to link hyperlinks to adjust the analysis automatically. It's a bit difficult now to summarize in a few words, but RevMan, it's something in progress, growing up together with us, and it's also possible to contribute, get involved, and Rebecca and colleagues love to get feedback from us. Thanks, Rebecca, for the link.
Great, thank you. Okay, any final questions or comments?
I just think it was a really good start. So sure we will potentially come back with questions once we start using it a bit more. But thanks for the intro.
Thank you. And you're, of course, very welcome to get in touch with us, either if you need help to sign up for RevMan or if you need a methodological support. So thank you so much for joining us here today, and best of luck now with RevMan. Thank you so much for joining us. Bye.
Bye.